Thanks, Rachel. And thanks everyone for taking time at lunch today to join us. We are thrilled to have Jeff Patterson with us. Before I introduce Jeff, just give you a couple highlights as to what lies ahead with the Leadership Center. Tomorrow at noon, we have a presentation workshop with Scott Allen from the Bowler School of Business at John Carroll at how to be the best virtual digital presenter, which is a skill that all of us are now trying desperately to master. So that'll go from noon until roughly 12:45. You can register on our website. And then next Monday and Tuesday, we're going to be with our great partner, the Cleveland International Film Festival, with a film that we are community partner on, Represent. And we're going to have Patrick Shepard from the film festival, as well as the film's creator, in a conversation on Monday. So we encourage you to watch that film. And then on Tuesday, we're going to continue with the discussion of the arts with Holly Fowler-Martins and other folks from the arts community in Cleveland and impact there. So that's what lies ahead. And now the moment you've all been waiting for, Mr. Patterson. So Jeff Patterson just celebrated his 8th anniversary as CEO of Cuyahoga Metropolitan Housing Authority. And that is not yet the tip of the mountain of 24 years of service to Cuyahoga County. He actually began in the city of Cleveland as an intern in the mayor's office and has just kept climbing ever since. So with CMHA, he oversees a roughly $260 million budget, 1,000 employees, 10,500 housing units, and 55,000 residents. And we're really looking forward to hearing about the impact that the pandemic has had upon these residents and upon the work of CMHA. Jeff sits on numerous boards and also has received numerous awards. And my favorite is, if you look at his bio, the very first award listed is Member of Leadership Cleveland, proud member of the class of 2010 with a big fan club here today. Thank you, Jeff.
Thank you. Good afternoon, everyone. I just want to first thank the Cleveland Leadership Center for creating a forum like this where folks get the opportunity to talk and to share a lot of the things that are going on. I mean, one of the best experiences about Leadership Cleveland for me was developing the relationships that we have to be able to bounce things off of in tough times like these. And so it's just been refreshing to be able to reach out to other people who are in the same or similar type of situations and be able to bounce things off of them, as well as figure out ways that we can collaborate. So as Mary Ann mentioned, I'm the Chief Executive Officer of the Cuyahoga Metropolitan Housing Authority. I want to say that, I enjoy that responsibility a great deal. I've been with the Housing Authority now for 18 years overall, and prior to that, I was, again, as she mentioned, with the City of Cleveland for about 13 years. So actually, I've been in the public sector now starting my 31st year. So I've had a lot of opportunity to work with people, and I've really been blessed to be able to do that. This pandemic has really, affected us in so many different ways. I know a lot of you, it affects you personally, but it also affects you professionally. From us, our job is to care and to provide housing for our residents. So that continues to be an essential function. So my staff and I have been here pretty much since things have been going on. We have worked an adjusted schedule in certain areas. So here at our main building, we have staff that comes in the morning from 8 to 12, and then we have staff that comes in the afternoon from 1 to 5. And then out in the sites, out of the properties, we have our maintenance and our managers working Monday, Wednesday, and Friday from 8 to 12, and then Tuesday and Thursday from 1 to 5. Again, our focus is being able to have that level of connectivity with our residents and provide services. Of the 55,000 people that we're responsible for through the public housing as well as the voucher program, we have over about 4,000 or 5,000 seniors, folks that are, over 60 that are residing in our facilities, in our housing. So there's a significant responsibility to try to make sure that we could do the things that we can to make them be comfortable. So we try to sanitize those buildings twice a day. That is twice a day. That's very important to try to make sure we do that. We also work hard to try to make sure that we do any emergency work orders and things like that. That's been a priority for us. You know, when you look at impact, and I know sometimes people may have the opinion that a lot of our residents do not work, but there are a significant number of our residents that work and perform many tasks across the city. And right now that's very tough because a lot of the jobs that a lot of my residents have are jobs that, you know, in industries that are really being hurt by the pandemic. So you look at the hotel industry, the hospitality industry, the restaurant industry, a lot of the stores where you have people that are just coming in and doing small businesses to help out. There are a lot of our residents that work in those places that have now been laid off. So now that means that there has to be an adjustment. If they go through the proper procedure, we try to adjust their rent to an amount that they can be able to pay. But over the long term, you know, HUD does not fund us at a level that they will be able to sustain that for a period of time. And then you still have people that need the bare necessities. So thank God that, you know, we've got some great partners like the food bank who has really worked with us to open, to have 9 food pantries at some of our sites. That has really done, I think, an outstanding job of allowing us to be able to get produce and food to our residents. And so many of our other community partners have, you know, gone out and done things where they dropped off meals and things like that and allowed us to be able to try to get things out to the residents. So from a residential standpoint, you know, I think that we're trying to do the best we can. The seniors and the folks that are in our properties, you know, they've kind of gotten used to dealing with us. Sometimes it's fun. Sometimes it's not quite as fun. Sometimes you just miss the person that you could yell at every day. And so we've got some folks that, you know, are struggling with, you know, not having the interaction that they need to have, not having the people that can help them do some of the things that they need to do. And this being a face-to-face business that we're in, you know, that makes it even more challenging. From a staffing standpoint, you know, I think the staff has done a phenomenal job. You know, I don't have a lot of people that are calling off and not coming to work, but I do have a lot of people who are legitimately concerned and legitimately, you know, uncomfortable sometimes. But I think their commitment to the residents, their commitment to what we do has been unwavering. But it is something to sit there and to have your own issues and your own things that you are trying to deal with, but also, you know, be willing to know that that our residents to us are in a lot of instances like family. And so sometimes you're willing to take an additional risk to serve and to help your family. So I have a lot of people that have been committed to doing that. So over the next, you know, few months, you know, we really have to look at how we can do the business that we do without having to do so much face-to-face. And that's going to be a significant challenge for us. How do you lease a unit to someone who's in need of housing, and you really want to be able to show them the unit and walk through the unit, but you also have to, you know, be cognizant of social distancing and things like that. When you want to go in and make repairs to a unit, you want to be able to make sure that you are able to have social distancing and make sure that you do things that are not going to put the resident in jeopardy, but also make sure you maintain the safety of your your employees. You know, a lot of you are folks who have a lot of digital capabilities and things like that. That's one of the things that a lot of the folks that are in our housing don't have. And that's a problem. You know, it's a problem now in terms of being able to communicate with people. I mean, we've done some great work with Digital C and some of the other entities to be able to try to get internet at some of our sites. But, you know, when this pandemic hit, it would just be nice to be able to have the broadband access to really be able to communicate and get information out to residents in an electronic manner, but also to make sure that that electronic capability can allow the kids to be able to have school. You know, I know Eric and his team at CMSD is doing a phenomenal job in terms of trying to get, you know, those Google Chromebooks and other things out to the youth. But, you know, if we can't have an infrastructure that allows those same youth to be able to have an internet in their homes, you know, that's not going, over the long term, that's not going to be in their best interest. So we have to find ways to be able to do that as we move forward. So I wanted to just kind of give you guys a brief picture of some of the things that we're doing. I do want to say that, you know, social distancing in a large housing facility is a challenge. You know, I commend my residents who are doing the best that they can. I can't say that they follow it every minute on the minute. I can say that, you know, most of the time when we are physically here during the day, I think that most folks try to adhere to it. But again, you know, when you are doing apartment living, such as when you were maybe in college or even before, you know, you get a comfort with the people that you see. And so it's not just gathering for the sake of gathering. It's gathering because those are people you know and you're checking up on them. So, you know, we've tried to balance that, but, you know, we've had to close the community centers. We've had to close the community rooms in those facilities so that we don't have people just go and just sit and collectively there. You know, when I got so used to having resident meetings and going out and talking with people and things like that. We're now trying to find other ways to do that same type of thing. So we're going to be looking to try to make sure we can maintain that level of commitment and things like that, you know. Last thing I'll say before, you know, we can jump into some questions and things like that is one of the boards that I sit on is, or one of the organizations I've been working with is the Kidney Foundation. And we're going to be doing a virtual kidney walk. I think it's June 14th. And when I look at something like that, you know, you look at the purpose of doing things and those things that mean stuff to people. And so, you know, kidney disease and other diseases are just challenges within themselves. But when you add them in the context of a pandemic like this, where you have underlying conditions that make you even more vulnerable, it heightens the awareness of being able to, you know, draw attention and make sure that there's focus to try to give folks help in all of those areas. So I think it's just important for us to support each other. It's important for us to know what each other is doing. And when we can find out ways to help, because while I know we're trying to work towards being able to open up again, and I completely understand that, I think we have to be concerned about moving so fast that we don't put ourselves in a worse position than the one we are in right now. So with that said, I'll turn it back over to you guys. And again, I thank you for taking the time to listen to me ramble for a little while.
Jeff, thank you so much. We've had quite a few questions come in. So to kick us off, we've heard the statistics around healthcare providers affected by the virus, as well as the rates in high-density living conditions. What has the effect been on your residents in terms of testing and positive results?
We have had a few folks that have gone through it. I don't want to over-disclose any medical information, but we have had a few folks that have done that, but not to the point where it's been widespread, which, you know, I think is a good testament to the residents, but I think it's also a good testament to the staff and some of the sanitizing of those facilities. And I think it's also a part of the governor's kind of stay-at-home order, which has, you know, really kind of, you know, put people sheltering in place.
Thank you. Looking at kind of implications on housing, how has this pandemic impacted housing availability with resources already being limited? What are things looking like now, and what could you foresee in terms of the need for low-income housing and your resources moving forward?
There's going to be a great need. There always is. But there's going to be a need from people that don't necessarily look at housing now, but will definitely need housing as we go forward. And I also think the number of people and the amount of subsidized housing will increase. So, you know, before, if someone was working, let's say they were working at Quicken Loans or well, I forget the new name, the Rocket Mortgage Stadium downtown. You know, before they may be making X amount of dollars and they would just be eligible for us to be able to house them. And a portion of their, you know, your rent is determined by 30% of your income. So if you had that income, it will be 30% of that, and the other part will be offset by HUD. Now, when you have fewer people working and things like that, then that means that the amount that has to be offset by HUD increases. And so the amount of funding that we would get, you know, it starts to begin to restrict how we may have dollars to do other things, because we may have to increase the dollars that we have to spend to subsidize more housing. So that's going to be a challenge for us as well.
A big piece of your programming is critical summer programs for children in your communities. What might that look like as you head into this summer?
Well, you know, that's a good question. And, you know, one of the things that we're looking at is, as we move forward, again, I know that there are folks that want to kind of, you know, open up and do things. We're going to spend the month of May really analyzing our operation and trying to find what the new norm looks like for us. And a big part of that is, what can we do with youth? How can we utilize them? How can we get them involved? But how can we make sure that they're safe? You know, it used to be you could just take a group of kids and say, okay, here, you could go here, and you could do this, that, and the other. Well, you can't do that now. And so, you know, I don't want to say that, you know, we're going to employ 100 youth to do X, Y, and Z if I can't employ those youth in a way that's going to be safe for them as well as safe for everyone that's involved.
So in thinking about your residents, how might you be getting information to them, many who might be very unaware that they're eligible for stimulus payments and some of the resources available?
We do a lot of posting within the building. We do a lot of information working with our resident leadership to help them to get the word out through their network. When we have some of the pantries and things like that, we try to get extra information out to people. One of the things that we did not have, but now we have gotten, is we have more of a robocall phone system, which allows us to get mass information out to our residents, both through phone as well as through text. And we also are sending out a lot more letters and information that way, and putting information on the rent statements as well.
So to date, what has been the greatest challenge you are facing in your role at this time?
It is a huge weight right now, I think, for any leader to be responsible for some of the things that we're doing, from asking people to come in to work, to trying to make sure that people are safe, to some of the decisions that you have to sit in the room and make, and even when you get the calls about people who may or may not be feeling well, and trying to, you know, want to make sure that you could be supportive of those individuals. This is just a time that, you know, I know I've never seen. You know, there have been challenges in the past from 9/11. I remember being at City Hall on 9/11, and I remember, you know, hearing about the first plane, and I turned on my television, and I remember sitting there, and I remember watching the second plane go into the tower. I remember us scrambling around the building and all of that stuff. But you felt that there was a point where you could say, okay, that's it for this. Let's start doing rebuilding. Let's start getting back. This is something that every day you wake up and there's only so much you could do, but you never know that it's going to end right at that point where you could say, okay, it's done. Now we can start to do this. You still have to be cautious. You still have to, be confident. You still have to understand that people are people, and people are used to being able to move around. And like I said, this weather that we've had, this crazy weather that we've had that's been cold, snow, rain, whatever, the inconsistency of the weather, I think, has helped in some regard, because, when you have good days, everybody wants to get out. But when you have bad days, it's been a little bit easier for people to shelter in place. And I think, fortunately, during this time, we've had more bad weather days than I think we've had good weather days.
Thank you for that. And looking at a comment here, so prior to COVID-19, CMHA, CMSD, and City of Cleveland and other local entities partnered in efforts to submit an application to have CMHA receive a grant to do a complete transformation of the housing units at 93 Woodland. Where are you with this as of now?
We're still waiting, and we're talking about our Woodhill estates. We're still waiting on getting the information back from HUD. Timing, I guess, is everything. We had expected that information to come out at the end of March. And when the pandemic struck, I think HUD kind of refocused some of their activities. So I'm hoping maybe early May, they may decide that, that may be something that could help, stimulate an economy and things like that by providing, construction jobs and other opportunities to people in this region. So we're still hopeful that we receive that opportunity.
So as you've shared about the challenges you and your team are facing in working with the residents, how are you maintaining that hope and positivity for yourself and your team?
Every day or every other day, I have Zoom calls or conference calls with my leadership team. Some are happy about that, some not as happy about that. I also have calls with my property managers as well, the people who are out there in the field, because I think, again, you can get lonely. You could get out there and feel like you're not connected to anyone, and you also could begin to feel that no one cares about what you're doing. So I try to call, I try to listen. I want them to tell me what's going on. I want them to tell me what they need, if it's equipment, things, materials, things like that. One of the things that we have decided to try to do is we actually are going to be kind of pulling together a group of residents that their sole purpose is going to be to make masks for other residents. Because some of the masks that some of the residents may be wearing are not, necessarily some of the masks that really protect them. So I have some very skilled folks that, are interested in doing that. So it's a great opportunity for them to do that. And again, this is not something that is going to go away anytime soon. You can't just give somebody one paper mask and think that that's going to last them for a while. So we're looking at different ways where the residents can help and be a part of it, as well as, we can do things to help as well.
And Jeff, we have one final question. For those of us on the call for our network, how can we support you, your team, and your residents in your work during this time?
I would just say to everyone, we're here. I'm here in the office. My email is jpatt@cmha.net, jpat@cmha.net. For me, the best way to do that is to talk. There may be opportunities that we could have by just having a conversation. There may be something that may be going on that just the fact that we have this conversation, you may say, I could be a part of that. You may have a presence in a community that has one of our buildings, and you may say, you know what, we'd like to do something for the residents in that building. We may want to donate some toiletries or things like that to the residents in that building. How could we go about doing something like that? It's not the level of the give. I think it's just the actual thought and the willingness to want to do it, because whatever is done will be appreciated. And the last thing I'll say is that it's not just within the confines of physical materials. I think it's in the confines of, as we have these discussions about the need for digital inclusion, as we have these discussions about funding and things like that, it's good when people see that housing is a bigger component of a larger community. So, you know, the more people to speak up to say, hey, well, I'm with CMSD, but I got kids that live in CMHA, or I'm from Cleveland Public Library, but the kids that come to my library are in CMHA. Whatever that is, you say that connection, and that strengthens the voice, and it makes it so that we all are able to be successful.
Jeff, thank you so much for your time and the insights to your work and how we can help you. We appreciate you joining us today, and thank you for all that you are doing for the residents of CMHA and our community.
Thank you, Rachel. Thank you, everyone.
And everyone, thank you for joining us today. We appreciate it. Hope you can join us next week for a leader lunch break. Sandra Miller, who is here on the call with us, will be speaking about her work at the Cleveland Rape Crisis Center, along with Melissa Graves, who is the Executive Director of the Domestic Violence and Child Advocacy Center. So we hope we will see you next week, and please join CLC for our noontime, lunchtime offerings. We have an array of topics and hope you can join us. So thank you all.
Thank you.